Hi, welcome to Many Questions. During Eating Disorders Awareness Week, there's a lot of information about what an eating disorder is and how to spot the signs. But do we know enough about what recovery looks like? In this episode, I sat down with mental health campaigner, author, and MQ ambassador Hope Virgo to discuss recovering from an eating disorder, the hidden side of mental health campaigning, and changes in education for eating disorders.
Huh?
So, I guess for our first question, how would you describe yourself and why?
Was thinking recently a lot about identity and kind of, like what defines me and defines people around me. The reason I was doing that is because I was thinking a lot about my own recovery from an eating disorder and how so much of the time when you have an eating disorder, it's how you describe yourself. So, and even for me, like being a campaigner on a day-to-day basis, I quite often would describe myself as, oh, I'm in recovery from an eating disorder. And it becomes such a massive part of you and your who you are and your identity and everything like that. But then since becoming a mum, I think like that starts to then take up another part of your identity. And so you kind of lose sight of who you are outside of being a mum. And then alongside that, I do a lot of campaigning. So I describe myself as a campaigner as well. So I think I've got lots of different like avenues that I probably explore and how I would describe myself. And I think honestly, they change based on what situation I'm in. But then, like with everything, I think when you're campaigning on mental health issues, it completely takes over your life. So again, you think about it a lot of the time. So yeah, I'd probably describe myself as a campaigner, someone in recovery from an eating disorder, and a mum. And then somewhere in between, I kind of flip between.
I guess that's the beautiful thing about being like a human is that we're all complex. There's various different sides to us, and I guess you just grow and adapt to every situation.
Particularly, I was thinking, like, particularly from an eating disorder perspective, your whole identity gets wrapped up in the illness. So even when you start your own recovery, you have to, in a way, like, kind of re-find yourself. And for me, I'm like in the final stages, I would say, of my recovery, but I still don't 100% know what that looks like outside of the kind of identity of an eating disorder. And I think, in a way, that's when it becomes risky doing loads of campaigning, because if you don't know who you are outside of that, you can kind of lose sight of your own recovery and that being a priority.
I've never really thought about that. How long have you had that kind of worry?
I have it quite a lot, actually. I think my tendency is to prioritize everything else or everyone else. And people have said to me in the past, and actually my godmother said it to me recently. She said, is your identity so wrapped up in campaigning that you kind of lose sight of who you are as well? And I was like, do you know what it potentially is that I've become this I've become an eating disorder campaigner. And I think part of that, I wonder, with recovery from something like anorexia is, although it's not about body image, your body changes and everyone judges how well you're doing with your recovery based on what you look like. So I think because there's that physical aspect to it, again, you probably second guess it a lot more than perhaps if it was another mental health issue. And I remember when I first started public speaking, actually, I felt, and I don't know if it happened or not, but I used to feel like I'd walk into a room and as soon as people found out the topic, they'd immediately start looking me up and down. And I'm sure it happened sometimes. I'm sure it didn't happen all the time, but I was so hyper aware of it that I think, again, that becomes, part of your identity, because you're like, I have to look this particular way in order to give myself credibility to talk about this. And I don't think that's right.
I guess that's kind of the problem with how society looks at disabilities on a whole.
Yeah, no, agreed. And I think with eating disorders, it is so like that. And we hear it all the time in like services, and people are trying to get support, but also in society. And I know that when I was unwell, people, and even actually throughout my recovery, people have tended to judge how well I'm doing on what I look like still. And even though I kind of campaign so much about that and trying to dismiss that as an aspect of it, it's still very much there when I have conversations with people. So I think if you're not even campaigning, it's probably like a whole other level. And I think we need to get to a point in society where we realize that eating disorders are about so much more than weight, and they don't have one particular look. Because if we're just looking for that stereotypical image in our head, there's going to be so many people never get that support. And even people like myself who maybe still struggle mentally every now and again, it's like, because people can't see we're struggling, like, what does that mean for us? Like, yes, we have to communicate a lot more, but actually it makes it much harder too.
I guess as we're already talking about that, when did you first discover that you possibly had an eating disorder?
Well, I was diagnosed when I was about 17 in CAMS. But before then, I think I had moments where I thought maybe like something wasn't quite right with me. So I'd been ill at this point since I was 12. Um, and the thing with eating disorders is they're so secretive that you don't tell anyone what's going on. And I'd kind of convinced myself that I'd found this one solution to my life where everything just felt amazing and wonderful and it was just incredible. And I really felt like I just couldn't talk to anybody about it. I spent a lot of my childhood, and particularly kind of amplified by being sexually abused, feeling categorically wrong with who I was. For me, the eating disorder solved all of that. So the thought of someone finding out about it absolutely terrified me. But during that kind of period before I was formally diagnosed, I did have these moments. I remember actually, like when I did my GCSEs, everyone used to like flood to Newquay, and there's like a week of everyone going out and drinking and eating and just sitting around and talking and stuff. And I remember being in this moment and just not understanding how all my friends could just eat and drink what they wanted to without any fear attached to it. And I'd be sitting there kind of ruminating over the food I'd had that day. I'd be obsessively counting everything I'd eaten. I'd be feeling so much guilt and trying to justify it to myself, trying to work out how I could compensate throughout the whole day. And I remember in those moments being like, maybe I have got something the matter, like if no one else is like that. But the thing for me with the eating disorder is because it was doing so much for me, it meant that in those moments, it just would kind of latch back on and be like, no, no, it's fine. Just do another day of this and it will all be fine. And so I think I didn't properly fully realize there was anything the matter until I was finally admitted to hospital.
It's frightening how early some of these things can take a hold of somebody.
Mm.
I guess we could talk about this a little bit later, but I guess some of the stigmas is that it happens later on in life and stuff, and that children don't really get affected by a lot of like mental health conditions, which that is sadly not the case.
Yeah.
When you compared yourself well, I guess to your peers, did you ever talk to them about some of the issues that you was dealing with?
No, not at all, actually. No, and I looking back, I don't know why I didn't.
Mhm.
Because I had some really good close like girlfriends. I went to an all girls school, and I had a lovely group of friends at school actually. But I didn't talk to them about it. I didn't talk about them about the abuse. I felt really embarrassed about that. I didn't talk to them about the eating stuff. And I think part of it with the eating stuff was I was embarrassed about the fact I was like that. But also, I was worried that people would try and intervene and try and kind of get involved. But the reality was, I think all my friends did know that something was going on. And I remember the night before I went into treatment, like officially went into hospital, I messaged all my friends and was like, oh, I've got to go to this place tomorrow. Let's all go out for dinner tonight, which in hindsight was the most ridiculous suggestion ever for someone with anorexia. And I remember going to Pizza Express with everyone, and we all got like dressed up. Like we used to go out a lot as a group of friends in the evenings. I don't think they really fully knew how to act around me. And I was just so like trying to just put on this front and pretend that I was okay. And I think that's something that actually I feel really strongly about particularly when I work in schools and stuff, is there's all these people who are like the way that I was at school, who kind of go through life and on the outside you look fine, you look like you've got this great group of friends around you, you put on a bit of a front every day and everyone just thinks you're this kind of bubbly chatty person, but actually inside you're really really struggling. And I really feel for those sorts of people who just cannot find the words to explain what's actually going on in all those moments. And that's exactly what I was like. And like I said, I don't think it's because I didn't have people to talk to. I think I just didn't feel like I knew how to talk about it.
Yeah, because I think what you're doing, especially campaigning about your lived experience, is incredibly brave. It's just how does somebody? I guess that's a question. But how do you get that bravery to actually talk about your lived experience?
I don't know if I feel that brave doing it. Yeah, I was so like just so frustrated by the lack of action around eating disorders, and I was so frustrated by just the huge lack of understanding that we see kind of day to day. I came out of treatment when I was 18, and then pretty much like functioned in recovery since then. But then my grandma passed away kind of 8 years into my kind of 8 years later. And I found it really, really difficult, her dying. I just couldn't process it. I couldn't deal with the emotions around it. And I relapsed at that point, and I kind of came through my relapse, and I had tried to get support during that time, but I hadn't been able to. I'd gone to the eating disorder service in South London, and I'd basically like been really articulate about what I needed, what had happened, what I was going through, what my history had looked like. And I was really, really honest. I think one of the reasons I was so honest was my mum came with me, and it helped kind of alleviate some of that guilt. But after coming through that relapse, I'd felt so let down by services that I kind of started to do my own research and kind of looking into it a little bit more. And it was at that point that I realized that being turned away from services for not being thin enough wasn't something that just happened to me, but it happens to so many people on a day-to-day basis, like all over the country. And it was at that point that I thought, you know what, I need to do something about this. So I just basically began campaigning at that point. I still get really nervous when I go and do stuff quite a lot of the time. I really struggled at the beginning to kind of set boundaries in place and basically try to fix every single person that I came into contact with and put a lot of pressure on myself to do that. And then used to get really annoyed and upset with myself when I couldn't do that. So then had to obviously kind of implement my own boundaries around what that would look like and how to manage that. But I think for me, it's, yeah, instead of a bravery thing, I think it was more just like a frustration. And I really enjoy it now. I really enjoy kind of meeting people and hearing their stories. And I feel like I've like got such a nice network of people around me that kind of champion what I'm doing and what I've set up, that then obviously helps me to kind of have the courage to keep going. And even things like I did this exhibition in Parliament recently, and people came, which I know sounds probably ridiculous, but like even when I did my protest, like people came, and it's like knowing that within the people that come there, there's people that I kind of looked around in the room and I was suddenly like, oh my goodness, that person's come, like that's really important. And it was things like that that actually you makes you think like, actually the reason I can do what I do is I've got people like that who cheer you on, look out for you, offer that additional support. On your own, it's good, but it can be so intensely lonely doing it on your own.
Yeah, difficult. I just want to go back a little bit to what you're saying. So I've spoken to quite a few people who have lived experience with an eating disorder, and one of the main the theme that everybody tends to have is that there's a problem with a diagnosis, or that it took quite a long time to actually truly get one. Why do you think that is?
Firstly, I think GPs don't have enough understanding about eating disorders. We know that they only get 2 hours of training on eating disorders throughout their whole medical degrees, which just is not enough. We also know that when people present to A&E, there's similar issues of kind of no one really understanding what to do. I think there's all the stigmas that come attached with eating disorders, that they only affect girls, that they're people choosing to be something, they're a vanity exercise, they're people being difficult. And I think all of those stigmas massively play into whether someone can get support. I think the other thing is if you're kind of on the verge of adulthood, people will just think, oh, you're just going to grow out of it in a couple of years' time, so let's just leave that person, which again, we know that's completely wrong. And I think beyond that, there is been so little training, so much kind of stigma and decades of underfunding, which means that people just cannot get the right support and there's no resources available. And so when they go and get a diagnosis, there's such a narrow kind of scope that they're looking for that it's basically impossible to get that support. And I think the really scary thing at the moment is people are basically being told they're not thin enough for support. They then go away, come back a couple of months later, and they're then told they're too sick for treatment. So unless you get in that window, it's very unlikely you're going to get treatment.
So I guess what can we do to change that? Slightly more training, or is it actually a new service coming in to alleviate some of the pressure?
I think it's both. So I think we need to have a better equipped workforce to support people, whether that's personally, I think all frontline staff. So everyone who works in A&E, we need doctors, we even need dentists to have an understanding of eating disorders so they know the signs to look out for. And that will help that kind of first point of call. I think in those moments, everyone knows that services are massively overstretched. So having that honest conversation when you have someone who comes and sees you is really important, because they don't just want to be told, oh, you're not thin enough for support. They need to have a proper, like, you know what, we've got a massive resource issue. This is what we can offer you in the interim. This is where you can go and get support in the interim, and then find a way to support them moving forward. I think that then we need to have a proper look at services and treatment. We know with eating disorders that there's not a huge amount of evidence-based treatment out there. And we know that particularly if people have been unwell for kind of 5+, 7+ years, they're basically being marked as untreatable, which is just so wrong. So we need to look at the services that we have around the country and work out how we can roll out the ones that have really good outcomes and how we can change the ones that just aren't working. And I think as soon as we do that, we'll start to alleviate some of the pressure on the NHS with regards to eating disorders. And then we can get the right support in for people much quicker. We know with eating disorders, particularly with anorexia, your brain is so starved that we have to get in there early to kind of tackle that, like the starvation symptoms and side effects that come alongside anorexia. And then that person can start having the psychological treatment. Because we're leaving people so long, that bit at the start where we're trying to sort their brain out from a food perspective will then take much longer.
I know you mentioned earlier about you're at the final stages of recovery. Do you mind explaining some of the stages that you've gone through, just so somebody else who's going through a similar situation will know whereabouts they are? Or was that not really applicable to other people's situations?
It could be applicable. I think it's probably not science based, but I think for me, so it started off with kind of going through a phase where I had to accept that something was the matter, and I kind of only accepted that I was unwell when I was on my third day in an inpatient unit. Before that, I hadn't really I guess I hadn't really accepted my diagnosis or anything like that. For me, the reason I began to accept it was the hospital I was in got me to do this exercise where I had to draw like this life-size version of my body on this massive piece of paper. It's the kind of thing that people do when they're children, and you kind of decorate it with stickers and stuff. But I drew this kind of life-size version of myself, and then they traced around the outside of my body. And then I had to stand up and look back down at that image. And I remember looking back, like how different the images were in that moment. And I kind of argued quite a bit with the nurse at that point, was like, you've definitely lied to me. Like, this can't be what I look like. And she literally kind of got me to analyze it against my body. And it was in that moment on that Friday night that I thought, do you know what? Something is a little bit wrong with my brain and how I view myself. And so for me, it was like that activity gave me the kind of, I guess, the kickstart to think, you know what, I'm going to give this a go. I then had to start to kind of fuel myself and help my brain to recover. And that was very much kind of the structure and the routine around food, kind of feeling loads of guilt around the meals, but trying to like unpack things, kind of removing all the emotion from the food. I then got to a healthy weight. And I think the first, like, I guess just a reminder that not everyone with anorexia will be underweight. Some people don't change weight, some people gain weight. But for me, I had to get to kind of a space where my weight was restored. But one of the issues with recovery from anorexia, particularly if you've been underweight, is that a lot of people restore to kind of the minimum weight they have to. And particularly in hospitals, that's the target they aim for. And we know at those kind of healthy but low weights, your brain doesn't fully recover. And there's a lot more research coming out about that at the moment. We also know that BMI is not really that accurate as a health measure in itself, but that's kind of a whole other issue too. But when I left hospital, I was basically at this point where I knew what I needed to eat to stay well. And I just stuck like religiously to my meal plan when I was in treatment. I then began to push some of the boundaries I had. I went traveling and worked abroad in Asia for a year after uni. And it was in that moment again that I was able to kind of push those boundaries a little bit more. So I think for lots of people in recovery from an eating disorder, we kind of settle in these kind of halfway houses where we still have dysfunctional relationships with food and with exercise. We still micromanage to some extent kind of food that we're eating. We find certain foods good, we label certain foods bad, we feel guilty at points, we don't fully let ourselves kind of completely go. And in order to fully recover, I think you have to get to a space where you can do that. So at the moment for me, kind of realizing that I've been in this kind of semi kind of halfway house recovery bit, I'm trying to challenge that. So I try and challenge all my fear foods on like a week to week basis. Whenever I think about food, I always eat. When I go to the shops, if I see something I want off the shelf, I'll buy it and I'll eat it. And it's trying to get to a space where you completely normalize food. And I think the thing that stops a lot of people at this point is at the moment I'm going through a period where I am so hungry basically the entire time. And it's my body just kind of catching up, my brain catching up with being in a state of starvation for X amount of years. And even though I've eaten well for the last, since last 6-7 years, probably beyond that since I came out of treatment, apart from when I relapsed, like you're still not fully letting yourself go. So you have to respect that and listen to that part of you. And I think that's where I'm at with it. And then alongside that, kind of continuing to work on things that trigger me, that kind of emotionally kind of dysregulate me. And again, trying to sort those out so that I don't immediately go back to the eating disorder behavior in those moments. And I think for me, going through a pregnancy with an eating disorder had a lot of challenges in itself. But I think, again, that's been for me like a massive learning curve as well. And it like helps me now in a space where I'm like, you know what, I want to be well enough for my son. So like I need to keep pushing to get to that point. And I probably make it sound really easy. And it's literally like one of the hardest things. I was thinking about it this morning, like the amount of pain that you have to go through in order to recover. And there's no shortcut. Like it's so frustrating. Like if there was a pill, I would take a pill to fully recover. Like I'd pay thousands for that, but there's not. And so you have to just go through it in order to fully heal.
I mean, honestly, credit to you for going through that whole journey, being able to shout about it and help others. That's really commendable.
Thanks.
I guess in saying that, tell me a little bit more about Dump the Scales.
Yeah, so I started Dump the Scales probably like 4 years ago by now. And I started it off the back of like the frustration that you had to look a certain way to have an eating disorder. And then over like the last couple of years, it's got much bigger in its kind of scope and now focuses a lot on funding, focuses a lot on the stigma, like looking a lot at prevention, public health campaigning within it. And then also looking at it from like a research perspective, making sure that we've got the right money also going into research for eating disorders, which I think is, again, you'll know better than me, but massively underfunded when it comes to the amount of money that goes into researching eating disorders as well.
Absolutely.
And it's gone, it's like it's had its ups and downs. I was going to say it's gone really well, but actually there has been some really rubbish moments with it. So I've spent a lot of time kind of in Parliament talking about it. I've been to Number 10 on multiple occasions to kind of talk about it with political advisors. But I think one of the things that we kind of get to this point, and then there's always this kind of stopping point where there's a conversation about funding, and then it's like, oh no, we don't have any money, or like there's still the stigma. And like we know that a lot of MPs are male, let's just be honest. And so again, I think that stops the funding going into it or the conversation to some extent, because they still think of it as a female's illness. And again, something that you grow out of, and it's not like that at all. Most recently, I've kind of brought into the campaigning, the Scales campaigning, all the issues around palliative care and eating disorders. So we know that there's 4 palliative care pathways across the country for eating disorders specifically. So at the moment, I'm kind of campaigning quite a lot to just try and shut those pathways down and to try and get people to realise that actually the right treatment can be out there for everyone, but it's thinking about what that looks like for that individual. So it's got quite a broad scope now, but it's good. I've still got a petition page. Over the next couple of months, we're doing another protest at the end of April, and then also kind of going back to Parliament with it at the beginning of March to talk about it again.
Actually, I will be there in April.
Perfect. It was really, I really enjoyed it. Like, if enjoy is the right word, I really enjoyed it last year when we all came together and kind of shouted about it. I thought that morning, there was going to be no one there. I was literally like counting on my fingers. I was like, I know this person will be there. This person will be. So it was wonderful actually to see like hundreds of people coming together. And I think particularly when you have an eating disorder, and I'm sure this is similar for other mental health issues as well, but you don't really ever fully feel like people understand what you're going through. And it's hard to kind of articulate sometimes that kind of mental torment that we live with on a day-to-day basis. And so being surrounded by other people who just get it and who just care was probably the highlight of the march for me.
And I encourage as many people to go as well. And links to the march will be at the bottom of the video. Well, thank you, Hope, and I hope you have a lovely day.
Cool. Thank you so much for having me.